Welcome to the Senior Citizens Talk of Hicgi News Agency. All our viewers around the world, from Dakar in Senegal and to the Antarctica, if there are some listeners there, to the Greenland, which Donald J. Trump wants to take over, Venezuela, Caracas, right away, Mail on Australia. Come back to Kampala, Uganda, where we are. My name is Chivumbi. Ernest Benjamin, bringing you the Senior Citizens Talk of Hicgi News Agency every single Sunday on our YouTube channel and to all our sister stations and televisions that we are supplied to. The kidney is a very vital organ of our body. The kidney does tremendous things that you and I do not know. But don't worry, we have a very special guest who is a doctor from the National Referral Hospital, Dr. Racheal Ndaada. Welcome to the Senior Citizens Talk.
Thank you, Mr. Chivumbi.
This week has been Valentine. On Friday, the world was celebrating Valentine. And
right.
How is your Valentine?
It's good. It's good. It's a good day. We are celebrating love.
Is love part of the medical world that we should
adhere?
Of course.
Last time, the Uganda Heart Institute put up a post saying if you're in a love relationship, then the risk of getting heart diseases are less.
Oh my God.
So anyone out there should be in a healthy relationship, love relationship. If it's not healthy, then you're at risk of getting heart diseases. So you need to maintain that as well. Yeah, but happy Valentine's to everyone. Yeah.
Well, so if you're having difficulty in your relationship, it's so important that it touches your heart, and the heart is very vital. But not looking at the heart, we're looking at the kidney. First of all, how is the National Referral Hospital?
Yeah, Mulago is good. We are doing well. It's in Uganda. It's the National Referral here. We are doing well. Doctors are there, nurses are there, patients come through, and I believe they're given services that they opt to get.
Yes.
Yeah.
And Doctor, could you please tell us, introducing us to the kidney, what is so special, or could you tell us more that we can learn about the kidney? Okay.
I think I didn't tell you my name. So my name is Racheal Ndaada Nangobi. I'm a medical officer in Mulago. So today, we get back to the topic. So the kidneys are one of the organs we have in the body. In the abdomen, they are a pair, so they are two on the right and the left. But if you don't have two, it doesn't mean you're abnormal.
Seriously?
There are those people that are born with one kidney.
One kidney?
Yes, and they actually live normally like you with two kidneys. And we have those that donate. So they remain with one and they give that other one to another person. So those two are also normal people. People have a myth that if they had a surgery sometime in their abdomen, maybe their other kidney was removed. That's not right. You can be born with just one kidney, but usually majority of the people have two kidneys. Yeah.
If I lose one, if I donate one and mine also something happens to it means the end of my life.
No, if it gets diseased, it's a process for a kidney to die really, and you can prevent its death. So even when you've stayed with one, we make sure you maintain that one kidney healthy so that it doesn't get a problem. But in case it gets a problem, still you are treated. You are treated until, you get better.
And what's the cost of treating the kidney?
Yeah, it is. It is. That is why we want people to prevent kidney disease, and you can prevent it.
Okay.
Yeah.
All right. Could you tell us more?
Okay. So saying there are two organs, the kidneys play a role in the body. One of the major roles is excretion. So the kidneys are going to filter, they receive blood from the heart, and then they're going to filter this blood, and they remove waste products, nitrogenous products, and then they're going to relieve some products in the system. We call them electrolytes. We have potassium, we have sodium.
The Senior Citizens Talk is brought to you by Africa at Heart, Heal the Planet Global Organization, Hicgi News Agency. Subscribe right now to get our latest updates and every single Sunday. Don't forget also the Talk to the World show that is running every Thursday at 4 p.m. Subscribe here on YouTube and
a notification bell right here. HICGI News Agency. Visit us on HICGINewsagency.com and find us on all social media platforms on X, call it Twitter, on TikTok, Instagram, and Facebook. HICGI News Agency. Subscribe now.
These are important in the body, so they'll stay, and the waste will go through the urine that you pass out. The waste is going to pass there. The kidneys have another role. They produce hormones. So one of the hormones is called erythropoietin. The doctors will
wow,
just say EPO. So erythropoietin plays a role in production of red blood cells. So the kidneys are playing a role in making sure that you have enough blood in your system, HB. So people with kidney disease tend to have less blood, and many of them are transfused because the erythropoietin is not being produced, and so blood levels are going to go down. Many more other organs, yes, play a role in production of blood, but the kidney also does. So it also produces calcitrol. For it, it's really for bones, bone strength, so the bones are really strong enough for you to carry out your day-to-day life. Another role we can talk about, they have something we call a RAS, renin-angiotensin system. For it, it balances blood pressure. People with hypertension, ordinarily call it blood pressure here, people with hypertension have a risk of developing kidney disease. But on the other hand, people with kidney disease have a risk of getting hypertension.
Two-way.
Yes, it's a two-way because of the renin-angiotensin system I'm talking about. They are hormones that are produced by the kidneys. In case there is a disorganization in any of those, then you're at risk of developing hypertension. Yeah. Those are many more functions, but those are the major ones that the kidney does.
Okay.
Yeah.
So when we talk about it's those who are worried or having hypertension, what could be the responsibility or precaution they should do so that they don't get to now another organ of the body getting a problem?
Okay. So people with hypertension, as I said, they are at risk of getting kidney disease. So what you have to do, before you know that you have hypertension, come for checkups. There is no way you're going to stay home and then you say, probably I get sick here and there. Hypertension mainly gives you headaches. You get some headaches. You could feel palpitations, is the heart beating very fast. You could get easy fatigability. You walk a short distance and you're tired.
Glovi Logistics Limited, your #1 customs clearing and forwarding cargo consolidation warehouse company. We do air shipment, worldwide sea shipment, transportation, tax consultation. Glovi Logistics Limited is a competent company specializing in logistics clearing and forwarding services. We have the necessary skills and resources and partnerships to tackle sizable projects to our clients' satisfaction. We are located at Mganziraza Plaza near the entrance of Katwe, Kampala, Uganda. Call us on +256 779 634 328 or +256 701 784 648, or visit our website glovylogistics.com or write to johnglovy@gmail.com. Glovi Logistics Limited, your #1 clearing and forwarding company.
So if you're having some of those symptoms, please get to know your blood pressure. So when you get to know that you're hypertensive, treat. Hypertension is a chronic disease that is not going to cure. It's chronic.
It's not going to cure?
No. You are going to stay on your medication for your life.
So there's nothing like the pressure is stabilized, so
They stabilize.
I should stop the medicine?
No. They are stabilizing because you're taking medication. So should you stop the medication, then you are going back to the high blood pressures you used to have. So if they have stabilized, thank God they have stabilized, maintain your drugs. So if you're taking drugs, pressures are stabilizing. So then you know that all my other organs, including the kidney, including the heart, are not going to get any trouble from the high blood pressures. So once you have known you're hypertensive, first thing, go to hospital, get checked, get your drugs, maintain the drugs. The hypertension is going to kill many of your organs, and particularly today we're talking about the kidneys, it's going to kill it, or them. So maintain blood pressures normal. Other people that are at risk, we need to talk about all of them. Those with liver disease, those with diabetes mellitus, they have a lot of risk to kidney injury. And not only those, if you're looking at kidney, a disease is divided. So you have an acute kidney injury. That means the kidney has been affected in less than 48 hours, 2 days.
Oh.
And we're having chronic, so more than 48 hours. So most patients we get, majority are beyond 48 hours because they have stayed home, they are trying to take tablets off the counter, pharmacy drugs. So by the time they're coming to hospital, then it's really past 48 hours and the kidneys have now turned into chronic disease, which you could work it out and see if they can get back. So those with acute kidney injury, I will talk about children. We have a lot of malaria in the tropics here in Uganda, and malaria equally has an effect to the kidneys. Yes, so those children, even adults, pregnant women, risk of malaria. So you are going to get severe malaria. There is an effect to the kidneys. In cases in less than 48 hours, acute kidney injury, treat the cause. It's malaria. Treat the malaria. And then you also focus on the kidneys. Eventually, they will get back to their normal state if you hurry to really seek medical attention. Another group of people that are at risk of getting AKI, acute kidney injury, are pregnant women. We have a lot of, we call it preeclampsia. It is hypertension that you develop when you're pregnant. To some people, it could actually resolve after you have delivered. You need to keep monitoring. To other people, it could actually turn from preeclampsia to you becoming unhypertensive, and it takes you forever being hypertensive. So those women, in case they have injury to their kidneys, some go through what we call hemodialysis. That is a management. We shall reach it and talk about it. And then their kidneys actually get back to normal. Some may not get back to normal and they end up with chronic kidney disease. Yeah. So how about those with chronic kidney disease? We've talked about the hypertensives. It is a process. The kidneys keep dying slowly, slowly, until they enter what we call end-stage renal disease. It's end stage. They are no longer doing their role. So if they're not doing their role at all, that means all your waste products, we said filtration is one of the roles, all the waste products are going to stay within the system. The electrolytes, we talked about the salts that have to stay and then some are excreted, are all going to stay in your system. Blood is not going to be produced. The system of controlling blood pressure is not there. So through that, those are the diseases you're actually going to get. So when the kidneys are sick, what do you feel? Let's start with its roles that we have talked about. So we have urea. Urea comes from the nitrogenous products that we take. Let's say amino acids, eggs break down, you get amino acids at the end. So when urea keeps accumulating, because the kidneys are not pushing it out through your urine, it accumulates, it gives you side effects. One of the things we have, we call it uremia, if urea is too much in your blood. So one, mental state. You get actually what we call uremic encephalopathy. We have seen people with kidney disease and they are, their mental state is down. They are confused. And then people, we have lots of myths. People are thinking someone has been bewitched, it's the kidneys that are sick, why are they confused? Why are they talking uncoordinated words? It's because of that. Urea is too high, it has gone beyond the optimal levels within the system. We have a uremic frost. You get a rash, you become white.
White?
Yes, because of the too much urea in your blood. Yes. We have what we call edema. So swelling of your legs, someone's face is swollen. If I push you back a little to the symptoms, people with kidney disease, as you're developing the kidney disease, you get facial puffiness.
What does that mean?
That is, your face is swelling, mainly in the morning. And as the day passes by, the size goes down. So you normalize as the day passes by. Eventually, you may ignore, because along the day, I'm getting fine. So eventually, if you keep ignoring, it will become permanent. Your face is puffy. What is causing that? We call it edema. It is fluid overload. You're having a lot of fluid. The kidneys have to release fluid through urine. Your kidneys are not doing that. So they are keeping all the water within your system. Your legs are swollen. Your face is swollen. The lungs equally get pulmonary edema. There is water that is also kept in the lungs, around the heart. So you get even difficult in breathing because of that. Just one organ in the abdomen is affecting all the other organs, okay? Then, of course, you get anemia. You don't have enough blood. You're paper white. We look at your eyes and you're really white. You're dizzy. You're very weak. That is what happens when you're developing.
For more than 10 years, Keb International Group has been your number one partner in tours and travel consultancy. We also do real estate, legal services, ICT services, and much more. Find us on kebinternationalgroup.com or write to us at info@kebinternationalgroup.com. You may also write to us at PO Box 35827 Kampala, Uganda, or visit us on Namaswahi off Entebbe Highway. Call us on +256 200937566 or +256 3948632 or 46. Or you can send us a plus on WhatsApp on +256 752 1375 66. Keb International Group, your number one real business partner.
All these kidney problems, yeah.
Okay. There's something called heart failure. Is there also something called kidney failure?
Yes, yes.
What does that mean?
Okay. So kidney failure, I hinted on it. I said end-stage renal disease. Yeah, so end-stage renal disease, it means the kidneys have died.
They have died. No,
They
it's
have
irreversible.
died. It's irreversible. So you can do a transplant if you got the money. In our
Like how much?
setting, I can't tell. I can't tell. Malago started doing kidney transplants. They've been doing and they've been successful. Yeah, so at least it's helping out for those with end-stage kidney disease. But on the other hand, we have what you call hemodialysis. If you've got an end-stage kidney disease, your kidneys are totally not doing anything. So you have all those symptoms. You're not healthy. So there's a machine that is now going to help wash out your blood. It's going to help wash your blood. So they connect a central line, and then that blood from you into the machine. The machine does the cleaning that the kidneys have to do, and then gets back into you. These machines are decorated. They are designed.
Is that
to
what you
do
call
that.
dialysis? Something?
Yeah, that is dialysis. I'm calling it hemodialysis because it's using blood.
Okay.
So yeah, dialysis is going to help you do the role of the kidney. People ask, for how long am I going to do the hemodialysis? It may be very hard for you to go off it. It means you may have to stay on it because it's now what it's doing.
For the rest of your life?
Yes, it's what it's doing, the kidney.
I think it's expensive.
Role. Yeah, it's expensive. It's pretty expensive. So then it really impacts on your finances, on family. And even those who are looking after such patients tend to get tired. I mean, I'm managing this person with a chronic disease. They're not going to heal. Every day I'm in hospital. So eventually such patients who used to come with attendants, they tend to drop off, and then they are coming alone into hospital to get all these services. But yeah, you stay on your dialysis.
The Senior Citizens Talk is brought to you by Africa at Heart, Heal the Planet Global Organization, HICGI News Agency. Subscribe right now to get our latest updates sent you every single Sunday. Don't forget also the Talk to the World show that is running every Thursday at 4 p.m. Subscribe here on YouTube and make your notification bell right here. HICGI News Agency. Visit us on hicginewsagency.com and find us on all social media platforms, on X, call it Twitter, on TikTok, Instagram, and Facebook. HICGI News Agency. Subscribe now.
It does the role, and then you get better. Transplant, as I said, it can also work. So before you reach dialysis, you can actually be managed. So you with those with acute, those with a chronic. So how do they manage you? They manage depending on the symptoms most times. So supportive care. So those with fluid overload, everything is swollen. There's some drugs you're given, loop diuretics. You're given those drugs to help reduce the volume of water. Yeah, so every time you take it, you actually urinate a lot to reduce on the fluid overload. If the electrolytes, the salts I talked about, are also overdue, they are deranged. There are drugs given, let's say for potassium, if it's too high, there are drugs that they'll give you. Sodium, there are drugs that they're going to give you to maintain their levels back to the normal. And then there's what we call the acid-base balance. In case there is some sort of acidosis, there's still some drugs that they're going to give you to help maintain the acid levels. And then for those with there are those with difficulty in breathing, typically they are not breathing. Oxygen therapy is there, so you have to get admitted and given support for oxygen. And then we have those patients that are coming in with their hypertension. Your blood pressures are high, we need to give you drugs to make sure blood pressures are maintained. Should we not, that means the kidneys are going to continue dying. Yeah.
There's also been fear that herbs, people who take so much herbs, also they may also, apart from affecting the liver, they may also affect the kidneys. Is that true?
Yes, so herbs, mainly, yes, it's the liver. I'm not a herbalist. I do not studied much about herbs through my medical school, but herbs are playing a role in really damaging many of the body organs. Uh, People tend to come to the doctors in hospital. They are given drugs to take, and then they'll take them for a while, they improve. And then people around them will tell them, don't use those drugs. How long are you going to stay on drugs for your entire life? I used this and this and it helped me. So they take the herbs and leave the medicine given. Eventually, when they come back to hospital, they come with very bad complications. They have developed the end-stage kidney disease. They have developed diabetes. Those who had already diabetes or hypertension have gotten all the complications to the disease. So I would rather, herbalists can tell us, but I would rather patients maintain the drugs we give them than using herbs that they don't understand how they work. Yeah.
But some patients also are disturbed every single day, taking drugs. Do also having your drugs your entire life also affect organs like the kidneys or the prescription and the contents of in medicines or tablets are enough for the body to
Regulate. Okay. I'll first talk about drugs causing kidney injury. There are drugs, they're called nephrotoxic agents that cause damage to the kidneys. One of them are the NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs. Those drugs, ibuprofen, piroxicam, and we take them a lot for headaches.
Oh, for headaches, okay.
We take them a lot. I have a backache, I have this ache, and then we take them. So when you take them a lot in really big quantities, that is when it would cause injury to the kidneys. Another drug is iodinated contrast. When we send patients to do CT scans, and we're asking for a contrasted CT scan, a patient's kidneys have to be tested to see if their renal function tests are good. If the renal function tests are good, then you are good to get the contrast. For those who have bad kidneys, the function tests are not good, then they will not get the contrast because then the contrast causes damage to the kidneys. Yeah, there's some contrast that may not cause damage. It's available in some other hospitals. So when a doctor gets that, then they will get to know what exactly they have to do for this patient in order to get a CT scan. So the drugs we give you, let's say you have a chronic disease and we are giving you drugs to take. These drugs are excreted from the body. Some are excreted through the liver, some are excreted through the kidneys. So if your kidneys are functioning right, your liver is functioning right, you're not taking drugs to cause damage to them, then you'll be able to excrete all the excess drugs. So you can take your drugs for your entire life and they'll keep getting excreted.
Oh.
Yes. So in case, I'll talk about HIV patients. Someone is HIV positive, but then they have a problem with their kidneys or they have diabetes. There are some drugs that will be removed from the regimen they're taking and they'll be replaced. That means we give you drugs depending on the functionality of the organs that excrete them. So should we find out, oh, this drug has to be excreted through the liver, but this patient's liver is not doing well, then we stop that drug and give you another drug that is excreted through another organ. So you shouldn't worry about that. Take the drugs, they're excreted. You keep the waste. If you take a drug it does its role. The remainder that has remained in the system is urinated. It will be excreted. Let's say if the kidneys are excreting, it will be excreted and you urinate it out. So you shouldn't worry about that. Yeah.
I was scared about
no,
that.
no, no, no. You shouldn't worry about that. Take the drugs as given. Yeah, it's you'll not have, maybe if you're talking about, some patients don't take drugs because of a pill burden. So let's say you have hypertension, you have 2 drugs for it. You have diabetes, you have 2 drugs for it. You have kidney disease, you have a cocktail of drugs for it. Yeah, so such patients really have a pill burden. Drugs are so many. So we try to divide them. You have drugs for morning, for lunch, for maybe dinner, and maybe in the night when you're going to sleep. So at least you're having about 2 pills every time, rather than taking a handful of drugs. It would also cause really patients don't comply because of that. But for you saying that doctor has given me drugs for a very long period of time for my entire life, your organs are excreting those drugs, so don't worry.
Okay,
Yeah.
so patients all over the world, if you're taking drugs, don't be scared about taking drugs. Keep taking drugs because there is the right quantity that has been approved by the World Health Organization and scientists all over the world. And if there's any medicine that maybe you're not comfortable with, you still can consult your physician to. They keep on changing, but so keep taking your drugs.
Yeah,
So,
yeah.
doctor, you said apart from chronic or having kidney disease as chronic, what else could be also contributing to kidney diseases?
Oh yeah. So if you're looking at how a kidney is getting injured, it can be pre-renal. So pre-renal is before you reach the kidney. Renal is when you have reached the kidney, and post-renal is after you have passed the kidney. That looks at how the kidney is arranged in
Three
in the
stages.
system. Yeah, so 3 stages of kidney disease. So renal, it means the kidney itself has been infected. Maybe you've gotten some sort of glomerulonephritis, so the kidney is injured. Pre-renal, we are looking at blood coming from the heart going to the kidney. So for pre-renal, people with anemia, let's say someone has, they got an accident or they bled too much and they don't have enough blood. So the kidney is also not getting enough blood. It could also affect them. Plus hypovolemia, it could also affect them. Then the major one most times that causes kidney disease is the post-renal. So after the kidneys, we go to the ureters, and then to the bladder, and then to the urethra, and then you urinate. So that entire system from the ureter downwards causes a lot of trouble to the kidneys, most of the people around. So how? If you're having an obstruction to any of the ureters, the bladder, or the urethra, so that means the kidneys are producing urine, but it's not going out. So they will keep their urine, they're getting big in size because something is obstructing, and eventually they will die from that you're not removing what they are producing. And then we're having a lot of urinary tract infections, mainly in women,
Okay.
even pregnant women. Even men get it, though I don't know why many of them don't come to hospital. Their health-seeking behavior is very poor.
Wow.
So they end up getting a lot of disease. So you're having these urinary tract infections, and then we have something we call pyelonephritis. So infection will keep ascending upwards until when it reaches your kidney, and it will cause damage to the kidneys because you're not treating. You keep taking maybe a painkiller, you get relief, and then you get trouble. The other thing is hydration, water. It may not be post-renal, but kidneys need the fluid part. They need this blood to be excreted. Blood has a fluid component of it, which we get from the fluids we take, the water, the juice, and all that. We have those people who totally don't take fluids, and they're proud of it. I mean, someone tells you, I can take a full day with just half a glass of water. Like, oh, okay. So they're also depleting the kidneys of their roles. Yeah, so because they're receiving very little, eventually that person is also going to produce very little urine. And then they're coming to you that they don't produce urine. When I talk about urine, it reminds me of a symptom that I did not mention. We call it oliguria. Oliguria is little urine. So if someone is passing very little urine, they also need to get worried. I mean, I'm taking all my fluids, I'm eating, I'm healthy, but my urine is very scanty. That means the kidneys should be having a problem. That's why you're getting very little urine coming through. Yeah.
Okay. This is something, if I take long, maybe flying or traveling on a bus, and I keep a lot of. I feel I want to go and ease myself, but I don't go ease myself. My blood is full. Is it dangerous to my kidneys?
Yes. So that's what we said, the bladder and all those parts below the kidney. So urinary tract infections actually come from many people that collect urine. I mean, you're traveling, you have time to go, but you don't want to go. Because, I mean, you're seemingly strong, I can handle, you know. So this urine in your bladder is going to attract bacteria. And these are the bacteria that are going to give us the urinary tract infections, which infections can actually ascend upwards and reach the kidneys and cause damage to them, the pyelonephritis we talked about, and cause damage to the kidneys. So uh, it does. You need to always excrete. Whenever you feel like my bladder is full, empty it. You ease yourself. Don't collect urine for so long. There is no reason to. You'll even get an accident actually, and you get a bladder rupture, because I mean your bladder is too full, so it's just right there. And should any injury come, you'll fall. Then it will get a cut on it. You get a rupture on it, and then you have to have a surgery.
Wow.
You know, so yeah, empty the bladder when you want to. Don't keep urine in the blood, and yet space is available.
Okay.
Yeah.
And then what are these patients that have to urinate every single time they feel they cannot keep the urine?
Yeah.
Is this something to do with kidneys or something?
No. Patients who are urinating every time, if it's not drugs, there's a drug I said called a loop diuretic that we give to patients to help reduce the water. So it will make you urinate a lot. That drug is there. And then if you're normal and you actually have no problem, you're not taking any of these drugs, but you're having frequency, you're urinating all the time, then something is wrong with your urinary tract system. Probably you need to check. They need to check your urine and see. You could be having a urinary tract infection that is developing. Yeah, so you need to check. But also on the other hand, I've seen patients who I think are psychologically, I don't know, someone tells you, I keep going to the toilet every 20 minutes, and they're actually urinating. And then you test their urine, and they're actually normal. They don't have a urinary tract infection. It is psychological. They put it in their brain that for me, every 30 minutes I go. And when you actually have a word with them, and you tell them, no, this time when it comes to your 30 minutes, don't go, and we see what happens. And eventually, they learn. They learn to go when they have to, not going because, you know.
The mind is telling you
because,
you should go.
yeah, the mind is telling you to. There's even no urine, but the mind is telling you to. You are used to that. Yeah, but if you're having frequency, which frequency is really serious, then you're probably developing a UTI, and maybe you need to do a urinalysis and see what's happening.
Okay.
Yeah.
And people who are addicted to alcohol and smoking, does it also affect the kidneys?
Alcohol, smoking, these other drugs, cocaine, marijuana, they affect all these organs. They do. And we have noticed a lot of stroke among young people that are actually not hypertensive.
Seriously?
Yes, we have seen stroke happening in old people, and many of them are either having diabetes or they're hypertensive. But this time, young people, no comorbidity, but they have a stroke. Drugs. Drugs are causing them a lot of trouble. So if you're taking any drugs, they can affect any of your organs, your heart, your kidneys, your brain. Alcohol, smoking, they can affect all these things. Smoking, yes, it's going to mainly affect the lungs, but you never know. Any other organ can be affected. So you rather stay healthy than really taking those things. And people with comorbidities, you're hypertensive, you're diabetic. What are you doing in the bar? Probably you're taking a soda, maybe, or you're taking a glass of juice. But don't take alcoholic drinks. Already you're having comorbidities. Your body is at risk of developing injury to all your organs. And then why are you smoking? Why are you drinking? You know? That brings me to lifestyle modification. We can actually stay healthy if we change our lifestyle.
Okay.
Yes. we can prevent the kidney disease, we can prevent hypertension, we can prevent diabetes if we are changing our lifestyle. Patients have come to us and you do kidney function tests, and kidney function tests are, they draw blood from you and then test that blood. So you do kidney function tests and you say, oh, there's some derangement happening, but we can do this and this, probably increase your water intake. If you don't take a lot of it, please increase. And then we can also restrict their food. Probably I should finish talking about that. Patients with kidney disease, that now we're talking about prevention as well. Patients with kidney disease, in case potassium is too high, potassium is one of the salts. If potassium is too high, we restrict.
Potassium is from which food?
Potassium is from now yellow foods. So matoke for us here,
okay.
bananas,
we love
pineapples,
matoke.
yes. So some of them have to be restricted for you to, first of all, maintain your potassium back to normal. Then we can see if we can take a little of the yellow foods that happens to the potassium. For sodium, it is salt. Mainly we get it from the salts. You'll see many of the kidney patients are told not to buy roadside snacks, samosas, chapatis, because for them they put salt for the general population. Like
yes.
Now for you, you have a kidney disease. Probably you need to make your own chapati with just a pinch of salt.
Wow.
You know, so they restrict because of the sodium, so it doesn't go very high. We have proteins, so the amino acids that are going to create the urea. So urea, we also restrict patients. Eggs, they have urea. A lot of proteinous foods, they have urea. So at times we have to maintain. But as we are trying to restrict, we don't totally get you off because you also need the proteins. There's something we call albumin. If it's less in your body, you could develop edema. That is get fluid overload. So we restrict with maintenance. Just have a little enough and you're good to go. So if you are now doing lifestyle modification, you're preventing hypertension. Patients come, as I said, we've done renal functions, we just advise on those foods and then also exercise. Now for patients with hypertension, someone comes and the blood pressures are quite slightly high. They look like pre-hypertensive. So we shall have a discussion with you. We're not going to give you drugs, but try to do ABC. Diet, fat diet, a lot of fat content. We try to discourage that. Exercise, try to reduce your weight. You'll see that many obese patients get a lot of comorbidities, a lot of hypertension, a lot of diabetes because, you know, the obesity. So we try to advise them to reduce weight, and then monitoring. Monitoring is very important.
Okay.
If you have had a blood pressure taken today and it is high, we shall tell you probably go back after about 3 days, have a check as you're doing your lifestyle modification. We give you about a month, 2 weeks, depending on what physician has seen you. And then you come back and we assess and see how you are. Many have actually gone back to normal. So we encourage them to continue with that lifestyle change. If it has refused and it is actually just going high, then you need the pills before we actually have the complications of these diseases. Yeah, likewise to the kidneys. Drink enough water, treat the diseases that come that could cause damage. Malaria, preeclampsia in women. Don't take drugs, the nephrotoxic drugs I talked about. Treat your comorbidities, hypertension, diabetes. Please have them treated and take your drugs, as we said. These drugs are being excreted. Don't worry about that. Yes. Yeah.
Wow. What more can you talk about the kidney?
What else? Okay. What else we could say is, if I don't want, many people ask, if I don't want dialysis, what can I do? And I also don't have money to do a transplant, you know, because both are pretty expensive. So what we can do is you really need to come for your checkups. Kidney patients are more with doctors than they are at home.
Oh.
And always interact with the physician in case anything has changed. But still, we give drugs and some drugs fail. Not every kidney patient goes for dialysis. Who do we choose to go for dialysis? There is a line of indications. If you have been treated with all the drugs we know of, trying to maintain your kidneys back to normal and still the functions are refusing, then you need to do the dialysis. But we have those patients that we have treated, we've given drugs, and they are actually okay. They are fine. They have gotten normal. At least you see there's a decrease in creatinine, in urea, in the electrolytes. You see there's a change. So those ones we could maintain and see how they are doing.
Glovi Logistics Limited, your number one customs clearing and forwarding cargo consolidation warehouse company. We do air shipment, worldwide sea shipment, transportation, tax consultation. Glovi Logistics Limited is a competent company specializing in logistics clearing and forwarding services. We have the necessary skills and resources and partnerships to tackle sizable projects to our clients' satisfaction. We are located at Mganziraza Plaza near the entrance of Katwe, Kampala, Uganda. Call us on +256 779 634 328 or +256 701 784 648 or visit our website glovilogistics.com or write to johnglovey@gmail.com. Glovi Logistics Limited, your number one clearing and forwarding company.
It's our CGI News Agency store with Dr. Racheal Ndaada Nangobi from the National Para Hospital, Mulago, Kampala, Uganda. I've been looking at the kidneys. Before we went to the break, I was asking you about developed countries and developing countries. Why are these cases more found according to your research? To do with kidney problems.
Okay. It may not be my research, it's people's research. So I've read it. All these countries are affected differently and there are reasons people give to it. Developing countries, it's where I belong. What is causing a lot of kidney disease here is the health-seeking behavior. As I said, the kidney disease, most times it's progressive. We said it's acute in 2 days, and then eventually it becomes worse. So since people don't have the finances to support them, some don't even have transport to go to the hospital, or drugs, okay, you're lucky you've gone to the hospital, drugs are written, but you can't purchase those drugs. So then trouble comes because they are not able to prevent damage when something small has happened. For the developed world, I could say maybe the sedimentary lifestyle. Here we eat a lot of natural, and then there's a lot of burgers, a lot of pizza, a lot of all that has a lot of fat. That people that side could eat and probably cause a lot of these non-communicable diseases, you know. Yeah, so it's two-way. All countries have it with those reasons that I have mentioned. Yeah.
There's some people who are trying to use diet as one of treating sicknesses around the world, and they tell you if you eat a pineapple, if you eat this fruit, if you do this thing, it helps you do this and this. Is there something that you can recommend people to be consuming in terms of eating to manage these kidney issues?
Well, there's not a particular fruit I'll tell you that go eat this to maintain your kidney. But I think I earlier mentioned what you don't have to eat when you have a kidney disease.
Okay.
For those who had it, it is very good to use food is medicine. We've studied that. Food is medicine. What food are we eating? The natural fruits, the natural foods that we have here, they are medicine because, I mean, there's not a lot of fat, there's not a lot of chemicals, there's not a lot of preservatives put in it. So yeah, if you're eating your fruits, if you're eating your food, what is medicine? So you can continue, just eat healthy, avoid the alcohol, avoid foods with a lot of preservatives. It helps really to maintain your health. Yeah.
Okay. Is there anything else you would wish to talk or summarize the kidney issues to the world or that we've not tackled?
I think we've really talked about everything. We've really talked about everything. And if there is anything we missed, probably we can talk about it some other time when we meet, or in case we missed it here and you've had a question, I've always wanted to know about this, you could ask through, maybe if we have Q&A on the platform.
Yes.
Yeah, but just to summarize a bit what we've been talking about, we said the kidney is very important, one of the very important. All organs are important, and we said there are two pairs, but you can have one. You can be born with renal agenesis, which is also okay. You can actually survive with one kidney. Kidneys play a very important role in maintaining the body electrolytes and then removing waste. They're the ones which help in the production of the urine, and the waste actually pass through the urine that we pass out. So if the kidneys are damaged, then you're going to have all these waste stay in your body. So always make sure the kidneys are not sick. We talked about how we manage kidney disease, or how kidney disease actually comes. We said kidney disease can come directly to the kidney, or it can be free before you reach the kidney, or it can be after the kidney. So try to prevent most of the things around here. We've had a lot of issues with pre-renal. You get a disease which you don't manage, and then eventually it causes damage to your kidney. So please treat all those etiologies. I'll still mention malaria. It's one of the common ones that we have here. And then preeclampsia, which is in pregnant women. And then comorbidities, we said hypertension, liver disease, diabetes. You have to maintain your health. Make sure your sugar levels, your blood pressure are in the normal range. So take your drugs. We said drugs are being excreted, so don't worry. If there's an excess of the drug, it's passed out of the body, so take your drugs. And then if you're having a UTI, if you're having anything that is obstructing urine from passing out, it's going to eventually cause damage to your kidneys. So make sure all those are looked at and they are managed. We talked about symptoms. How do I know I have a kidney disease? We said one of the major causes is the radiofacial puffiness, facial swelling early in the morning, resolves as the day passes by. Eventually you get edema, your legs are swelling, your entire body is full, your tummy is having water, your lungs are having water. Eventually you get difficulty in breathing, and then you can have mental confusion, you can become white, and then you're anemic, you don't have enough blood, you're getting all dizziness. So all those things happen when you're having kidney disease. It may also happen in other diseases, but also the kidney, it gives you that trouble. So you're going to hospital. We said there are tests that are done. They would want to do a blood workup to see how your kidneys are working and see your creatinine, your urea, your electrolytes, what levels are they, do they need treatment? And treatment of course will be given depending on the lab results. They would want to do a scan and look at how are these kidneys looking like, and then there's some calculations that we do, estimated GFR, and say the levels that this particular individual is at. If it's just an acute kidney injury, which we said is about 48 hours, there's a possibility of you being treated and the kidneys get back to normal. If it is chronic, it has taken over 48, you may actually stay with the disease forever, so it becomes chronic until when you end up with maybe the kidney failure or the end-stage renal disease, which yes, we.
For more than 10 years, Hicgi International Group has been your #1 partner in tours and travel consultancy. We also do real estate, legal services, ICT services, and much more. Find us on HicgiInternationalGroup.com or write to us at info@HicgiInternationalGroup.com. You may also write to us at PO Box 35827 Kampala, Uganda, or visit us on Namaswa Hill off Entebbe Highway. Call us on +256 200937566 or +256 3948632 or 46. Or you can send us plus on WhatsApp on +256 752 1375 66. Hicgi International Group, your #1 real business partner.
And do conservative management. Those are the tablets that we give. And then the lifestyle modification that we keep discussing. And then in case all these are failed, then patients are advised to either do dialysis or a transplant, depending. But it's very important, if you're having a kidney disease, you've already gotten it and you are living with it, you can actually push on if you take your drugs as prescribed, and then if you are working on your diet. We have said potassium is from the yellows. Here we have a lot of yellow foods. If you've been restricted, please leave them or take a little of them, depending on what your doctor told you. Roadside foods with a lot of salt, they also have an impact. You restrict those. At times patients are restricted on fluid intake. You're swollen, you have a lot of water. So at times you're restricted, take this little water. And I mentioned earlier that also those who are healthy need to take water to keep the kidneys working. And now here, if you're very huge, a lot of water everywhere, you may be restricted. Drugs are given. I talked of the loop diuretics that help with releasing the excess water. Yes, they'll be given to you and then you have to take them. Those with comorbidities, as I said, take the drugs such that you prevent injury to the kidneys. Yeah, I think that will do for us.
It's been a pleasure to talk to Dr. Racheal Ndaada from the National Referral Hospital Mulago here in Kampala, Uganda. This show is being brought to you by CABE International Group, the Heal the Planet Global Organization, Africa at Heart, and other partners here on the Hicgi News Agency. All our viewers, keep subscribing to our YouTube channel and follow us on Instagram, Twitter, call it X, on or other social media platforms, and of course our main website that brings you news every single day from all over the world. And the local stations in Uganda, Radio Simba at 8 a.m. normally I review our news stories every single time. We'll be having Dr. Racheal Nangobi oftenly, because the world needs to get better, because health is wealth. We need each one of us to live longer. Take care of yourself. And on the camera has been President Scovia Chivumbi. Until next time, my name is Chivumbi Ernest Benjamin.
The Senior Citizens Talk is brought to you by Africa at Heart, Heal the Planet Global Organization, Hicgi News Agency. Subscribe right now to get our latest updates sent every single Sunday. Don't forget also the Talk to the World show that is running every Thursday at 4 p.m. Subscribe here on YouTube and make your notification bell right here. Hicgi News Agency. Visit us on hicginewsagency.com and find us on all social media platforms, on X, call it Twitter, on TikTok, Instagram and Facebook. Hicgi News Agency. Subscribe now.